Naruvi Hospitals, promoted by the Sanko Foundation, is the brainchild of the founder-chairman, Dr. G.V. Sampath. Belonging to Vellore, the medical hub of India, Dr. Sampath's vision to create a medical destination for the people of Vellore in particular and others from India at large and also overseas resulted in the establishment of a hospital here, a real crown jewel in the field of healthcare. Large numbers of people belonging to Vellore and the surrounding districts have been known to travel to Chennai and Bengaluru, both nearly 200 kilometers away from Vellore, seeking medical care due to the dearth of facilities and the hardships faced by the locals to access available services. As per the vision of the chairman, the best in healthcare, both in terms of medical and nursing professionals as well as sophistication, were infused into the institution, making sure that patient affordability was addressed at all times. Less than a month after Naruvi Hospitals opened its doors to the public, the second wave of COVID loomed large as life. We took on the challenge and quickly rose to the occasion, catering to the local population and some from outstation as well, adding close to 40 critical care beds and over 200 ward beds to the COVID care pool. Much as it was hard for a 1-month-old hospital to handle such large volumes of very sick patients, Naruvi Hospitals was able to contribute significantly in our country's efforts to save people from the disastrous end that COVID was driving people to. Naruvi Hospitals is positioned as a high-end tertiary care center. Our focus on ethics, transparency, patient satisfaction, and an academic outlook in everything we do ensures that doctors, nurses, and others in the care team are performing at their conscientious best to not only treat patients' ailments, but also to make them happy overall when they leave our hospital. We have tied up with the Henry Ford Health System, HFHS, based out of Michigan State in the United States of America. HFHS is one of the old and leading healthcare delivery systems in Midwestern America. The main aim of this tie-up is to have constant transfer of knowledge and to get access to the time-tested practices they have been following for decades, which ultimately translated to patient care. Naruvi Hospitals is a completely paperless and filmless hospital. The Naruvi philosophy of care is embodied by our motto, Fragrance of Care. The doctors in Naruvi are largely trained in the best of medical institutes in India and come with years of rich experience in their fields of expertise. With the philosophy and its pallbearers, the medical and nursing professionals, the high-end equipment, and the building infrastructure complete the holistic picture of Fragrance of Care. The hospital is 475 bedded with a 25% critical care bed count. Naruvi Hospitals boasts of an over 5 lakh square foot building spanning 14 levels. The building is completely air conditioned, conforming to ASHRAE standards with zone-specific air conditioning to reduce cross-infection between different care areas. Our laundry is 100% barrier washed. We have a top-of-the-line sterilization department with machines with 95% water-saving machines, saving up to 300 liters of water every running hour. We have all the major medical and surgical specialties. There are 16 modular operation theatres with laminar airflow. All the equipment in the ICUs and OTs are pendant mount to avoid clutter on the floor. All the departments are equipped to the most modern standards with the best and latest equipment so as to be able to provide the best end-to-end treatment to our patients. State-of-the-art cardiac cath labs, the latest robotic hybrid OT, ECMO, interventional pulmonology, high-end orthopedics, general and bariatric surgery, epilepsy monitoring unit with robot-guided epilepsy surgery, neuro monitoring, navigation, the latest lithotripter, urology laser are just some of the arrows in our quiver. Our primary focus, though being the local Vellore people and Indians at large, we are working towards attracting overseas patients as well. We have started an office in North Sudan in Khartoum. We are in the process of tying up with the governments of Oman and Seychelles as well. In all, Naruvi Hospitals is more than a hospital. It is an experience.
Hi, good morning. May I please request all of our panelists to kindly turn on their cameras as we get our session started. Yes, I see the cameras coming on. Thank you so much. So with that being said, let's get this super duper webinar started. So good morning and a warm welcome to all of you present here today. My name is Hiba and it's my pleasure to welcome you all to this awesome webinar on healthy spine, healthy life brought to you by Naruvi Hospitals Vellore and the Hindus Healthy India, Happy India initiative, where our ultimate motive is to prevent illness and promote wellness. As one must be knowing, a strong spine is the backbone of a healthy life, and undoubtedly, we need to take very, very good care of it. Hence, today we will dive into how simple habits can protect our spine and boost our overall well being. And of course, to give us more information on this super resourceful topic, we are delighted to have three doctors from Narvi Hospitals Vellore who are here to share their information and insights with us. So please join me in welcoming. Firstly, we have Dr. Bhupesh P, consultant neurosurgery. A warm welcome to you, doctor. We also have Dr. Bakyaraj D, consultant spine surgery. A warm welcome to you as well, sir. And of course, we have Dr. Vinita Verghese, consultant physical medicine and rehabilitation. A warm welcome to you as well, ma'am. So with that being said, let's get all of the conversations started. Our first speaker will be none other than Dr. Bhupesh P. So he is a certified consultant neurosurgeon who holds an MBBS degree from Madras Medical College, having graduated in the year 2005. He further pursued his DNB in neurosurgery in the year 2015. He has received specialized training in robot assisted surgery at the Claudio Munari Center for Epilepsy and Parkinson's Surgery in Italy and currently serves as a consultant neurosurgeon at Naruvi Hospitals Vellore. And in addition to neurosurgery, he specializes in various areas, including brain and spine tumor surgery, robot assisted surgery, and cervical disc replacement surgery as well. And of course, he is a distinguished member of the Neurological Society of India. So, warm welcome to you, Doctor. The floor is all yours.
Thank you, Hiba, for the introduction. Good morning to everyone. Today, as a part of the Narvi Hindu collaboration webinar, I'm going to talk about workplace ergonomics. This topic is close to me because I do have a workplace and I do have to deal with it ergonomically to upkeep my spine health. In this topic, I will be giving an introduction about spine health, the changes in the lifestyle that affects it. I would touch upon basics of ergonomics and the relevance to the spine health. Although there is no such thing as a home ergonomics, but it's also important, it's just an extension of the workplace ergonomics. This applies to homemakers, especially women who have inescapable responsibilities compared to the office goers. Spine health is crucial for maintaining the overall quality of life. It protects the vital structure called the spinal cord. It is essential for the body's functions. A healthy spine will promote physical, mental, and emotional well being. To maintain a healthy spine, one has to follow proper posture and ergonomic practices. Regular exercises and balanced diet will keep you light and running. Hence, prioritizing on spine health will ensure overall well being. What has changed in our lifestyle that has impacted the spine health? Lifestyle has improved since our ancestors. We have got better standards of living, better life expectancy, and better medical care. Along with this betterment, these progresses have brought in challenges like pollution, sedentary lifestyle, smoking, highly refined pre-processed food, and packaged food, almost all of them leading to obesity and its associated non-communicable diseases like diabetes and hypertension. Urbanization has led to affordable housing at the suburbs needing longer distance to travel to work on a daily basis. The family trends are shifting basically due to cultural changes and economic consideration. The joint families are replaced by nuclear families. Personal space and independence is prioritized over collective living and shared responsibility. There is a lack of emotional support in this. So, coming to the basics of ergonomics, the word ergon in ergonomics means work and nomos means loss. It is just a scientific approach to fit the work to the worker based on the physical principles. The outcome of this can be considered as a better output with less collateral bodily damage. So, what are the risk factors during the workplace? And these are all. I'll enumerate it. Posture. You have an awkward posture when you sit or stand and work in awkward posture. When you lift frequently and wrongly weights in your workplace. Compressive forces. Repetition, including something like typewriting, keyboard, vibration like driving. All these are risk factors for which affects your spine health. Now, there are other conditions which can cause uh, which exaggerated all these. It's usually the duration of exposure, the intensity of the work, the temperature, workplace, stress, organizational issues. Now, this picture will be a little bit more explanatory. Will show that you have a lady lifting weight on her head. All the weight goes to the spine, and also on the right hand side you have a local bus and a imported bus. The seating portion you need to notice that the other portion is a local bus. The driver sits forward, and then the steering wheel is not aligned to the driver's position. So they are more prone to get back pains than the ergonomically positioned seats. There are, other than that, there are personal risk factors like age, gender, hobbies, previous injuries, physical and medical conditions, smoking, fatigue. So, what are all the symptoms that happens when you have a problem? You will have painful aching muscles, tingling or numbness, shooting or stabbing pains, swelling or inflammation, warmth, stiffness or difficulty in moving, burning sensation, pain during the night, loss of strength and mobility. Now, this is a small snippet of information, scientific information. Uh, you can see the left upper image showing a lever mechanism, which all we know. The best lever mechanism is to hold it away from the pivot point, and so that you can lift a big rock. Here, below that is a biomechanical principle of spine, of lifting weight. The distance away from the body is lifted will cause more weight to be transferred to the spine. Muscle has to work more. On the right side, you can see that in the diagram that you have a pivot point, and you have a muscle in the back, and you have a load at a distance. It is like you are opening a door nearby the hinge, so that your muscle gets almost all the force. It is not at all good for the muscle, and it is not at a mechanical advantage for the spine also. Now, this is a MRI. On the left side is a normal MRI of the spine, cervical spine, neck region. You can see the bone and the spinal cord. The brown thing is the spinal cord, and along with it the bone. You can see the curvature, which is almost linear and smooth. You can see similar image on the right hand side on a patient who had a neck pain, probably having a diseased spine. You can see irregularities on the contour of the bone surface, on the compressing on the spinal canal. And I'm just going to play a video of this. You can see that the movement is not smooth, it is somewhat jagged, and the spine is not flexing appropriately. This is a problem when you have a degeneration of your spine. This movement gets affected, and then this will cause back pains. So it's the MRI finding may not cause back pain, but if you have back pain or neck pain, your MRI may show something like this. So then it becomes a symptom that needs to be considered for a treatment. I'm going to talk, ergonomics is for almost entire body, but I'm going to talk only relevance, whatever that is relevance to the spine health. In the next few slides are directed especially to the employers who will need healthy employees, and the employees should know why they have the symptoms. All the images that I'm going to show are available widely in the internet, and in case if you need to refer it later. This is a office chair which is having a height adjustable seat, height adjustable headrest, backrest, so that it would help holding up the spine when you are seated for a longer duration in your office. The other, this is a desktop setup. You can see that the distance between the screen should be of arm length away, and you should have cushions to keep your forearm rest, and all the necessary items should be at a reachable distance. Patients who are not willing to sit, they can have also work on a standing kiosk like this, which can a desk which is height adjustable. Now, this is available in all the guidelines, ergonomic guidelines. This is just a reiteration of the previous slide. All you need to have at arm length distance from the screen. You need to keep the monitor at the height, which is at 10 to 15 degrees of the normal side. And then you need to work in such a way that you should not dangle your legs. The legs should be on the floor, and you should not have your shoulders armrest should be placed in such a way that the shoulder should not dangle. The posture should be upright, not slouched forward. So this is the proper lifting technique. In the previous slide, I showed the biomechanics of the spine, why it takes the beating. This lifting technique shows that you lift the object which is nearby to your body and the spine, and to keep the spine straight when lifting it, rather than bending forward and lifting it. So the torso of the body is up almost 60% of the total body weight, which also has to be lifted by the spine when you're lifting an object. So to prevent that, you need to keep your object nearby and lift it by flexing your legs rather than bending forwards. As employees, it is not always possible to get the best in the ergonomics at workplace. However, there are personal methods like 20-20-20 rule, which is to avoid eye strain. You take a break every 20 seconds out of the screen, and something called as a micro break in repetitive task. It's like taking a 20-second break every 20 minutes or so, not more than 10 minutes in an hour, and performing light stretch exercises during the break. The basic idea here is to move your body more frequently than being seated in an awkward posture for a longer duration. That's it. Thank you.
Thank you very much, sir, for giving this webinar a super duper start with all of your information. Great starting note for all of us. Also, to all of the audience, in case you have any questions about the webinar or anything about this topic, we have a Q&A box where you can put up all of your queries, and towards the end, we'll have all of our doctors answer them for you. So make sure you take use of this opportunity. With that, we'll move on to our next speaker. We are super honored to welcome Dr. Bhakyaraj D, a distinguished spine surgeon with strong academic and clinical background. He completed his MBBS from Keelpok Medical College and earned his MS in orthopedics from AIIMS New Delhi. And he further specialized in spine surgery through fellowships in Bengaluru and Germany. With experience as an assistant and associate professor in reputed medical colleges across Tamil Nadu, he now serves as a consultant spine surgeon at Naruvi Hospitals, Vellore. So warm welcome to you once again, Dr. Bhakyaraj. The floor is all yours.
Thanks for the intro. Why we are concerned about back when we are speaking about happy life? Because back pain is the most common, second most common complaint by which the patient sees the hospital. First common complaint is common cold and fever. So second most common complaint by which a patient reaches hospital is back pain. So it's utmost important to take care of your spine. So spine, it supports our body and protects the spinal cord, and also it forms a stable base over which our arms and legs can move. So to call it a healthy spine, we need a strong bones and flexible ligaments, and the disc should be cushiony, and we need to have strong muscles. So our bones, like how much money you have in our account decides about your wealth. So how much minerals you have in the bone decides about your bone strength. So we can accumulate mineral in our bone up to age of 30. After that, every year we lose 0.5 to 1% every year. So as we are young adolescents and youngsters, we need to accumulate as much of money as possible. Like that, we need to accumulate as much of minerals in our bones, so we will not end up in osteoporosis early. So to do that, we need to have adequate amount of calcium and vitamin D rich diet along with proteins. We need to do strength, weight bearing exercises and resistance exercises to strengthen our bone. To make the ligaments strong and flexible, we need to do physically active and isometric exercises, and healthy dose of protein is required. Come to the disc, it is a most common cause for back pain and back related issues. It is a cushion like substance between our bones. It doesn't have a blood vessel, it gets its blood supply by diffusion from the adjacent bones. So to get that nutrition, the disc has to move, press and release. As the movement happens, it gets the nutrition. If there is no movement, the disc does not get any nutrition, there is chance for degeneration. So be active. First thing to maintain healthy life is be active. Moving the body gives strength to the muscles. At the same time, it provides more blood supply to the ligaments, bones, and discs. And also the movement provides some stress to the bone, so the bone we can protect it from degrading early, and we can delay the onset of osteoporosis. And prolonged sitting, as I said, if you don't move, the nutrition for the disc decreases, it may cause degeneration. So any too much spine spent on any specific position, either sitting, standing, walking, jogging, anything, too much time spent on in one position can be detrimental. So if it is possible, alternate your body position as frequent as possible. As Dr. Bube said, good posture is always, it distributes the weight evenly, so it reduces strains on the muscles. What is good posture? So you need to see four things. Align your body. So the shoulder, hip, knee and ankle should be in a single line. And engage your core while standing. So use abdominal muscles, gluteus and spine muscles when you are standing. And relax your shoulders. Don't keep it elevated. Keep it dropped and pull it back. And align your head. The head ear should be at the level of your shoulder, and the chin, the jawbone should be parallel to the ground. So even while sitting, you can follow the same thing. So lose excess weight. Whenever you are any machine which when it's overloaded, it tend to fail early. So like that, more you weigh, more strain on your spine, and the weight is also poorly distributed. So losing weight, not only you will feel better, you will also take pressure off your spine. And Dr. Bhupesh said everything about how the workplace need to be. But what after the work? Because working time we need to do that. If it is a desktop, you need to be in the desk, or you can stand for some time. But anyway, you need to be in the room with the desktop. But when you are at home, it's your own time. You can decide what need to be done. Most of us not doing it properly. If your work is a heavy manual worker, or if you are a sports person, you can relax at home in the couch, seeing a TV, or playing a video game, or doing desk carom, chess, like that. But if you're a desk job, white collar job, or if you are driving as a profession, then you need to do outdoor activities which provides weight bearing exercises, walking or swimming, like that. So while bending, you use your legs, not the back. And when you are using a backpack, it should be as close to your body as possible, and the uh, more weighing product should be in the lower level, and always use both straps. Don't use only one strap. So it causes eccentric loading. And again, stress is most of the time it's ignored. Stress causes pain because the muscle tone increases constantly. Muscle contracts, so persons develop pain in the neck and shoulder region. And second reason is pain. The stress decreases the threshold for pain, so you are more prone to the same pain impulse will be more to a person who's having stress. And it releases the cortisol, so it causes inflammation of the body. Relaxation techniques like deep breathing exercise, meditation, and yoga can be done. Regular physical activity itself is a very good for reducing the stress and as well as promote the muscle power. And this quit smoking is very important because it has proven scientifically that it deprives the spinal tissue, any tissue in the body, of essential nutrition by constricting the arterioles, constricting the blood vessels, which provides nutrition to the body, thereby increases the accelerated wear and tear. And because the blood supply to tissue decreases, the healing potential of the body also decreases. So even if there is some injury, it prolongs the recovery. So quit smoking and vaping not only benefits your spine, but also it improves overall health, and it decreases the cancer risk and respiratory issues. This is prone worldwide. There are more under thousands of articles are there. There is no doubt about it. Okay. Thank you. Thank you for this.
Thank you very much, sir, for giving us your thoughts on the topic. We move on to our next speaker right now. Before that, and if anybody has any questions, you can put them up in the Q&A box, and we will have a Q&A session after this presentation. So make sure you have all of your queries answered. So with that, our next speaker will be Dr. Vinitha Verghese, who is a rehabilitation medicine physician with a strong focus on adult and pediatric neurorehabilitation. She holds an MD in physical medicine and rehabilitation and currently serves as a consultant at Naruvi Hospital's Vellore. Her key areas of expertise include stroke rehabilitation, neurocognitive assessment, and community-based rehabilitation, to name just a few. She's worked with reputed hospitals, including the Bengaluru Baptist Hospital, and completed an observership at Phoenix Children's Hospital in the US. We are super honored to have you here with us, ma'am. So over to you. The floor is completely yours.
Thank you, Ms. Heber. So I'd actually like to thank Professor Dr. Henry Prakash for being my guide and mentor. So today we'll dive into some of the usual why, when, how, what questions that most people have when you're talking about exercises. So a lot of people say, why should we? Because many generations ago, people were not exercising simply because of, the process of evolution where we're all, as most people know it, the desk jobs that we have. So one of the easiest and simple home-based tests to say that, okay, my spine is relatively healthy or I'm relatively healthy is to do what we call the famous flamingo test. So typically you stand either next to somebody or next to a surface, and if you're able to close your eyes and lift one leg from the ground, this is a good test of balance, and it's also a good test of muscle control. So typically you have to engage your trunk, your pelvis, and that one leg that you're standing on. And the duration of doing this will sort of give you a good idea of how good your balance is, and hence an interpretation of how good these muscles are. When is a good age to start exercising? If you ask me, most of us would say now. It doesn't matter how old you are. I think I take inspiration from this from my mom. At 50 plus, she decided to do one of the hill marathons, and she did a 10K. So I think it doesn't matter how old you are. I think today is a good time to start exercising. So one of the main sort of go-tos before you start exercising is to make sure that you have good mobility at your joints. So before you start all of your strength training, making sure that you're flexible at your hip and your spine is a good way to start. This is what we would typically call a warm up before you start most of your exercise routines. Now, when people say exercises, what type of exercises for the spine? One of the simpler ways to do this, there's a lot of follow along exercises that are there on YouTube, and most of them are actually very good. So, this is something that you can do at your home. Just make sure you're engaging. So, look at it as three parts: your abdomen, your what we would call your anterior part, your posterior segment, which is all the spine muscles along your back, and also your what we call your buttocks or your glutes. So that's a good way to start. And also don't forget to include your lateral side or the muscles on your side. So it's basically you're making sure that you're engaging your muscles on all your sides. So how often would you do this? So far, what we know is that for men, about 4 reps of each exercise is doing 4 sets is good. And for women, it's 4 reps in 4 sets. So typically you would go about this depending on what your goal is. So if like a lot of young people like to build bulk, then you're trying to increase your repetitions and lower your weight. But as you age, if you're trying to maybe pick up your grocery bag, then your goal would be at that point power, so lower reps and higher weight. So that's how it should give you a good idea of how you titrate your exercises. And finally, when we look at the spine muscles, imagine your entire spine is like a philharmonic orchestra. So each and every person in the orchestra has to play their part, and it has to be in a united manner with different tempo and volume. So that's exactly how you would like your muscles of your spine to behave with the joint. So finally, you're trying to gain a purposeful movement, and so that's how your muscles need to coordinate and function. So yeah, hopefully this gives you a good base to start exercising today.
Thank you very much, Doctor, for sharing your thoughts and your presentation. With that, we will move on to some discussions based on, I think we have 25 questions as of now. So let's see how it goes. So we have a few questions coming up. Our first one goes, which type of mattress is recommended if I have back pain? Should it be a hard one or a soft one? So any thoughts on that question, doctors?
It should be a firm mattress. Neither it's very soft or hard. Actually, the spring mattress, better to avoid the spring and soft mattress. It should be a firm mattress, so it will contour according to your spine. That's it.
Okay, so thank you very much for your thoughts on that. Our next question goes, is obesity caused by spine-related problems? Somebody asks us, so any thoughts on that from any of you?
I think
Yes,
maybe,
Doctor.
sorry, maybe the other way around. I think obesity can result in a lot of spine issues. But also it can be a vicious cycle. You have back pain, you say you don't want to exercise, and then again you're putting on more weight.
Highly possible. Yes, thank you very much for that amazing answer. We'll move on to our next question, which goes, does disc bulge or degeneration, which contributes more to radiating nerve pain through the legs? Is it disc bulge or degeneration? Any thoughts on that? Yes, Dr. Bhupesh, you have any thoughts on that? Oh, you're on mute, doctor. You're muted, doctor. Yes.
Sorry.
Yes.
So both disc bulge and degeneration almost can cause radiating nerve pain, and nerve pain is radiating because either a bone component or the disc component is compressing the nerve. So degeneration and disc bulge are hand and glove together. So idea is to avoid this by moving. If you don't move and age catches up, your wear and tear happens on everyday basis and healing happens on everyday basis. The healing will be slower as you age and if you don't move, and the wear and tear will be more when you are obese or when you are not moving, when you are doing repetitive tasks and then damaging your straining your spine. So actually, that is a symptom which needs to be treated. This topic is to avoid getting a symptom in the first place.
Goes hand in hand. Thank you very much, doctor, for sharing your thoughts on that question. We move on to our next one. Is hypertension caused by spine-related problems? Any thoughts on that? Is hypertension caused by spine problems? Yes, Dr. Bakiraj.
There is no direct causative for hypertension and spine, but probably chronic pain. Because of the chronic pain, they are not doing routine activities, they are becoming obese, then that indirectly can cause spine hypertension. But otherwise, there's no direct correlation between spine, hypertension, and spine.
Yes. Yes, that was a great answer. Thank you very much. So we'll move on to our next question that goes, I'm suffering from writer's cramp. Is there any treatment for this disease? And can repetitive writing from my affected hand lead to spine issues? As from the last few days, I'm feeling discomfort with the bending of my neck. It's basically about writer's cramp, and writing from the affected hand is causing him a little discomfort. So any thoughts and advice to person? Yes, Dr. Bhupesh.
Writer's cramp, I'm not sure, but it can be treated. Who doesn't have, who her job is to write and something like that, there are options to do a deep brain stimulation as a surgical procedure for the writer's cramp. But it is very rarely done, because unless there is a clear evidence on an imaging that they would improve with a trial run, surgical procedures will not be commonly done. And for the neck problem, this is probably because of his posture. If he has to adjust for the posture, then the neck pain would become better. And all he needs is to keep up with the posture and then strengthen his neck core, neck muscles, and then work on.
Yes, and it'll be solved. Yes, thank you very much for that answer, doctor. We'll move on to our next question that goes, can normal pregnancy or C-section affect the spine? Any thoughts on that?
Yeah, so usually what happens is as your fetus or baby is growing, you're going to have a tilt in your pelvis, and so your spine is going to curve. That's, I think, a normal progression as you go through pregnancy. So usually a lot of aches and pains is a result of that. And so there are exercises that are offered during pregnancy to help this shift. It's a very physiological process.
Thank you very much, doctor, for that answer. We'll move on to our next question. What are the benefits and risks of surgical interventions for spinal conditions, such as spinal fusion? Yes. Any answers on that? Benefits and risks of surgical interventions for spinal conditions, such as spinal fusion? Any thoughts on
I think it's
that?
for Bakiraj.
Yes, Dr. Bakiraj. Your thoughts on the
Yes,
question.
spine surgery, need to see for the what reason it has been done. But if any spine related issue which is causing neurological deficit, that is, if patient develops weakness or numbness in legs or hands, and the nerves getting affected, or the patient is not able to do the routine daily activities because of the spine, we can undergo surgery. There are many surgeries. I'm not sure with specific condition they are asking. But definitely after surgery for limited patients or specifically indicated patients, surgery will be beneficial.
Oh, got it. Thank you very much, doctor. Our next question is from a student. So she says that like it's very common thing that's happening nowadays because of work from home and students working on their laptops for a long time. They have neck pain. So she's asking, how do you actually fix a neck hump due to long working hours on laptop while being seated? So any thoughts on how do you actually fix a neck?
This presentation is, we gave the same thing, answer to this in this presentation. All you need is to keep up your posture appropriate and keep the monitors in the position of your eye level and then work and move on. That's the thing. This will also improve.
Thank you very much,
To
Doctor.
add one more to that, many people think that this usually the neck and upper back junction, they will have some that spinous process anatomy itself is mind up is there, and females tend to have more fat collection and that area if they are chubby. So I have come across 2 3 patients. They are saying, sir, my back is proved whether it's we have done MRI to prove that nothing is there, just fat collection.
Yes, thank you very much, Doctor. It will surely help the person who asked this question. We'll move on to our next question that goes, will weight loss or change in diet lead to disc problems or spine problems? Any thoughts on that? Yes, Dr. Bhupesh, if you have any thoughts to share.
Is more weight loss lead to disc problems? More weight loss is the question is not that clear. Weight loss will actually improvise the spine health actually. On appropriate weight, yes. But if they are having problems considering they are losing more weight, then probably they are losing also bone strength. In a secondary kind of example, having a cancer or something like that. In that sense, they can have spine problems, spine bone can break. So more weight loss is not a condition. At least appropriate weight, reaching the appropriate weight is more important than more weight loss.
Absolutely. Thank you very much, Doctor. Our next question is quite lengthy. So it goes, I had an L4, L5 disc prolapse in 2003-4. Since then, fine, my BMI is 27. But when I do some stuff like folding the clothes, fetching the stuff from my box, I have a relapse. Apart from avoiding this, what else can I do to stay safe? So a situation in hand, any thoughts on that?
I think
Yes.
most commonly people tend to avoid doing an activity that causes pain. But unfortunately, that isn't the solution to your problem. We're not trying to sort of strengthen the muscles that actually need to be strengthened or improve flexibility. So as avoiding your pain should be a very short-term process. I think working on the muscles that need strength and also the joints that need flexibility would perhaps help.
Thank you very much, Doctor, for that answer. Our next question goes, please advise me regarding back pain due to riding a two-wheeler for long distance to work every day. I think a very common problem. We have a few questions repetitive on the same topic. So any thoughts on that from your end?
Yeah, this is a part of the presentation also, my presentation also. Riding a motorcycle for long distance to work every day has become a habit nowadays. And because of the changes that we are going through, all we have to is to carpool in case or travel by a public transport or a car. That would be also coming up now with the electrification. We might have carpooling more common, but this will take probably a decade or so, some more. Yeah.
Yes, perfect solution. Thank you very much, Doctor. We move on to our next question that goes, what are some precautions that should be taken for keeping our spine healthy and fit, especially after reaching our 60s? So we can have thoughts from each of you, 1 or 2 thoughts from each of you to summarize this question up. We'll start off with Dr. Bakiraj first.
After 60, there is no age limit for exercise, or as Dr. Anita Varghese said, you start exercising. As you age old, you should understand that you are not 20, you are 60 now. You should not do extreme activities, sudden extreme activities. So people tend to, most of the patients who are traveling abroad, they come back with a doctor in airport. I lifted a weight, so I developed some bad knee. So you should keep on working out. Slowly you increase your workout time and strength, endurance. That's all. There is no age for exercise. Exercise is always beneficial for spine, all bones, knee, and all bones in the body, all joints in the body. So keep on moving, keep on doing exercises to your physiological limits. Don't excel too much.
Absolutely. So Dr. Bhupesh, any thoughts from you on this question?
On this,
Advice.
again, it is the same thing. Like age does not stop us from doing. It is like you have to do, you have to know how to keep your spine healthy. And whenever there is a need, step down your activities and do the exercise, keep up your muscles, and then get back to your routine activities. I do it regularly. Even though I work, I don't have a major manual work or something like that. But whenever we would be working on a microscope, staying on a long term in awkward posture. Whenever I get a back pain, I used to start doing my back strengthening exercises for some time and then get rid of it. Age doesn't matter, but you will, as age advances, you are going to have a age aged spine, and it is going to easily wear and tear. All you have to keep up with your nutrition and activities. That's all.
Absolutely. Thank you very much, Doctor. Dr. Vinita, any thoughts from your end on advice for people in their 60s?
Yeah, I think that's a very good question. So, what the first thing that I think is very important is diet, because making sure your protein is at a good level to make sure your muscle health is good, a good vitamin D level so that you take care of your bones, and finally loading that bone. So, one of the biggest things I think challenge wise is maintaining form when you exercise. So, if you have somebody at home with you who can just sort of video you as you exercise or can sort of guide you, making sure that your form is okay when you're trying all these exercises for the first time. And then as you go, you will know how much you can build up on your exercises. So I think it's a good question. I hope you start today.
Yes. Thank you very much, ma'am, for your thoughts on that. We'll move on to our next question that goes, can fluid between joints be regenerated naturally? Fluid between the joints be regenerated naturally. Okay, is that possible? Yes or no? So any answers from your end?
I think a simple answer is, sorry, Dr. Mukesh.
Yeah, please proceed.
I think, most of us are talking about reverse aging, in that we forget our body tends to age naturally, and that's part of that is some amount of decreased fluid as you age. And that's okay as long as you're building the muscle around that joint so that you're still protecting that joint from as much wear and tear as possible.
Yes, absolutely. Dr. Bhupesh, you were adding a point.
Yeah, I just want to add. See, the fluid between joints be regenerated naturally. It is always generated naturally. We cannot do anything about it. And as the wear and tear increases, healing happens, and the type of collagen which it heals is not the natural collagen. And as age advances, regularly healing keeps on happening, and hence the fluid between the joints is tending to decrease. This puts sharing forces on the joints, and they both meet each other, and then the traction forces will work. It will damage the cartilages, and then the problem happens. So we can only avoid it we can only prolong it, but age will always catch up.
Absolutely. Thank you very much, both of you, for sharing your thoughts on that. Our next question is again a little lengthy, so let's see how it goes. How can we proactively address the increased risk of osteoporosis, osteoarthritis, and lower back pain in older adults, especially post-menopausal women? What strategies, including medical, nutritional, and lifestyle interventions, should be implemented to support joint and spinal health in this population? Yes. Any
Rakesh, I
thoughts
think
on
it's for you.
Yes, Dr. Bhakyaraj.
No,
Your thoughts.
osteoporosis, anyway, that's what I present while presenting and said, you need to accumulate your bone minerals when you are young. So you can reach your peak bone mass by age of around 30 for both on females and males. So before that, you should be very active. So if you have crossed that age, so next thing is to decrease, every year it decreases 5 to 5%, sorry, 0.5% to 1%. To delay the decrease, you can do the routine exercises, weight bearing exercises, jogging, running, swimming, those things. And during menopause, the females suddenly it becomes around, within 5 years they lose around 10%. Usually in 5 years it will be less than 5%. So during menopause time, they should take adequate calcium, vitamin D, and physical exercises. There are some drugs, hormone replacement drugs are available. Depending on the medical condition, they need to consult a doctor and they can take all these things. And there are some other medical drugs for both bisphosphonates, which decreases the resorption of bone. So those drugs are available. That can be tried when you are become 50, 60 years and the osteoporosis too. Everything will delay the osteoporosis. Best option is you accumulate as much as possible during your younger age, so you can spend it when you are old.
Yes, absolutely. So thank you very much for answering that question for us. Our next question is about rehab. So I think Dr. Vanita, this question goes for you. It says, which rehab team members are integral part of post-spine injury, and what is the role of occupational therapists and who are they?
Yeah, that's a very interesting question. So an occupational therapist is somebody who's able to return you back to your function. So if there's a part of you that is not working as well as it should, for example, somebody with a stroke, they have two goals here. One is to try and maximize function on the weak side, and at the same time also compensate with the other whatever you have available to still achieve a goal. It can be as simple as eating, dressing. So that's what an occupational therapist does. Now they vary across subspecialties. So this they've actually, or rather super specialized as hand therapists and so on. So um a rehab team usually has a physiatrist, a physiotherapist, an occupational therapist. I think that's what builds your rehab team. And so we all have a common goal, and our common goal is to make sure you're able to return back to your function. And that can be anywhere from just going back to being able to eat, sleep well, and all of that, or even returning back to your work and sports. So the goal really is very dependent on the person. Yeah.
Yes, thank you very much, Dr. Vinita, for giving us that awesome answer. We move on to our next question. That is, can spinal pain eventually lead to cervical spondylosis? Any thoughts on that?
I'll answer this. This is something. Cervical spondylosis can cause spinal pain. Okay, and the opposite is not true. You can have neck spasm, muscle spasm for anybody at any age because of the awkward posture. But as the wear and tear increases, the bone changes will happen. That will lead to spondylosis. That is spondylosis. And pain will happen because the muscles are not able to efficiently function because the movement is affected, not proper. And then they develop something called as a spine pain.
So the other way around. Thank you very much, doctor, for sharing your thoughts. We move on to our next question. That is, I'm unable to climb the stairs easily and need railings to support me. However, when I come down, I don't face this problem. What could the issue be and how should I resolve it? So, any thoughts on that? Yes. How do you fix?
Bakaraj, is it?
Yeah.
It's
So,
like
if it's spine-related issues, patient will find
it's not.
difficulty in climbing down, not climbing up. But they may be having muscle weakness or knee pain. Knee pain, which if they have severe knee pain, it's difficult for them to climb up. And as a overall, their muscles are weak. That I will say. But spine-related issue, definitely they will find difficult while climbing down rather than climbing up.
Yes,
Anything else?
And this is something which is confounding because it's a very little information. We are not able to justify saying that it is relevant to the spine in the first place. It can be any muscular weakness, generally local muscle problem from vitamin E deficiency to anything else. So we may not be able to answer it. What is the problem? Then only you can answer how to resolve.
Absolutely, sir. That does justify. Thank you very much. Our next question goes, what does having a constant back pain multiple times a day in different intensity at your early 20s signify? And what is the best solution? Back pain at different intensities in your early 20s and a possible solution for that. So any insights from your end? Yes, Dr. Bhupesh, you were
Yeah,
saying something.
this 20-year-old means probably they're going through their end of school or early college phase. And constant back pain multiple times in a day, different intensity, puts them probably having either a vitamin deficiency, vitamin D, B12 deficiency, or their build may be different. They may be obese at the earlier age. Number three, they might be traveling longer distance to get to colleges or something like that, and or seated in a wrong posture while they are studying or anything. The most important thing is that they might have a psychological problem which they are not able to get past through the stresses that they are they are facing in their life. They present with something like back pains or neck pains. The body tries to bring it up like this, so it looks more like that than anything else as a problem. So the best solution is to start moving, get into aerobic exercises, meditation or something like that, yoga or something like that, and then change the posture and try to live on and try to just put all these difficult things in the back and just move forward in life.
Said posture, so I also fix my posture so many times throughout the entire call. So I think it's a great wake-up call for all of us. Thank you very much for bringing light on that. We'll take our last few questions as we have 4 minutes left for the webinar to end. So my next question goes, does a compressed disc with numbness down the leg always need surgery, or will a spine rehab exercise improve the numbness? Dr. Vinita, if you would like to share your insights on that. Does a compressed disc with numbness down the leg always need surgery, or will spine rehab exercises improve the numbness?
I think the neurosurgeons would
I
actually.
think Bakiraj will be the best person to
Yeah.
answer this.
Anyway,
Yes,
in
sir,
the
please.
spine, anyway, surgery is decided on, anyway, if the patient has only back pain and radicular pain without much weakness. So usually the disc whatever has come out, it has a tendency to shrink within 6 weeks to 3 months. So we usually will wait for that time, 6 weeks to 3 months. Most of the time, 90 to 95% of patient will get better. The pain will decrease. The one point is every week the pain should decrease. If you see, then we think that they are going to improve. Without that, if it is keep on increasing, the pain every week or every month it keep on increasing, then we need to intervene. If they don't have a severe radicular pain, it's the only back pain, we have options like after trying out the physiotherapy and medicines. If it is not getting better, we can try giving the injection, local steroid injections. That's most of the time it helps. Only after trying all these exercises, medicine and injections, if it's nothing get better and it disturbs them, and otherwise patient has weakness completely, having foot drop, complete weakness of the muscles, then we may have to consider surgery.
Okay.
On blankly, we can say around less than 5% of patient requires surgery for disc or radicular pain. Most of the time it gets better with other modalities.
Beautifully summed up. Thank you very much, Doctor, for your thoughts on that. We'll take our last 2 questions before we call it a day. So, this question I'm going to build up a little bit more. So, nowadays in school, we see children carrying their school bags on one shoulder, or like heavy weight on just one shoulder. So, can that lead to spine problems? Is a question that one of them is asking. So, your solutions on that.
I think trying
Bakiraj,
to.
yeah,
Sorry.
yeah.
Go ahead, Dr.
Yeah, Vinita, please.
I think trying to convince school kids to put their backpacks on two shoulders might be a little hard, especially when it comes to your style statement and how they want to, be seen. Usually the younger school going children, uh, actually most of the time they're physically a lot more active. Will it lead to back pain because you're loading one side? Sure, because you're going to shift your weight to the other side. Uh, but most of the time, as long as they're physically active, I think this is quite a resolvable issue. So would I try to convince them otherwise? Go ahead. But I think if you can convince them to exercise, I think you would win there.
Absolutely. Thank you very much, Doctor, for sharing your thoughts on that. Our last question goes, do you have any pillow recommendations for good spine health? If yes, what would they be? So any thoughts on that? All of us can just give
So there
a
is
point.
some cervical contour pillows are available that can be used while sleeping. But the main thing is whenever you sleep, your thorax and cervical spine should be in a single line. It should not be crooked. When you are lying on your lateral shoulder, then there is adequate gap to keep a bigger sized pillow. But when you are lying supine, the gap is less, so need to depending on your sleeping style, you need to decide your pillow.
Yes, absolutely. So
Most
I
of
think
the
with that,
time, what I
yes,
advise is rather than concentrating on how to sleep and those things, because that is not in our control. Till you fall into sleep, you can think about all these things. After that, our position will change. Better you do activity when you are awake. That matters more than what you are doing while sleeping.
yes, Doctor, absolutely. I think we can give a clap to ourselves because our webinar truly said healthy spine, healthy life, and all of our thoughts came up with that so beautifully. So, with that, we come to the end of this awesome webinar on healthy spine, healthy life, brought to you by Naruvi Hospitals Vellore and the Hindus Healthy India, Happy India initiative. Thank you all so much for joining us on a Sunday morning, now afternoon. Stay happy, stay healthy. Thank you very much, and see you all very, very soon. Thank you so much, doctors, once again.
Thank you. See you.